I'm Logan Crawford, and right now on Spotlight, we have the extraordinary honor of featuring Dr. Albert Youvati. He is a distinguished academic and cardiothoracic surgeon whose life story encapsulates the essence of resilience, love, and the twists of fate. In his latest book, This to Me, the doctor shares his profound journey from a national and international medical expert to a devoted caregiver for his soulmate Sharon and his personal battle with multiple myeloma. This narrative is not just a memoir, it is a testament to the human spirit, woven with humor, history, and unwavering passion. We're delighted to have this very talented author join us here today on Spotlight, and we ask viewers like you to support writers like him by subscribing to our channel and by purchasing his very powerful and insightful book. The links are below this interview. Doctor, great to see you here today on Spotlight.
Okay, thank you very much for the invite. Happy to be here.
Your story really is inspirational. Your transition from a renowned surgeon to a caregiver and then a patient yourself gives you a unique perspective on healthcare. Tell us a little bit about how it influenced your empathy and care within the medical community as well.
Well, it still does. About a week ago, I was in the ICU. They've been weaning me off my steroids for my cancer therapy, and my blood pressure went way, way down and had to get to the ER and the ICU. But, with appropriate treatment, here I am, again, another battle. But yeah, it started out, you never think about this. You think you're very healthy, you compare yourself, you kind of look at things as a provider taking care of patients that you see and perceive as being ill and sick. And some patients who are your age who, my God, they look really, really bad, like they really had a lot of medical issues. And then, suddenly your life changes around when, I'm the one that found my wife with her stroke early in the morning. I knew exactly what it was. Unfortunately, the residual is the left side of the brain is your speech center. So that went out. So that's so frustrating for her. And she was very, very dynamic person, very intelligent. So it's very frustrating for her. So I had to take over everything, finances, everything. And then, I was having some back issues after, for a bit. I did a lot of running and half marathons. And I went to lift a lawnmower and I thought I ruptured a disc. And sure enough, it wasn't. The third lobar vertebra was totally eaten away by multiple myeloma. Now, suddenly I became a patient.
Yeah.
And here's the interesting thing, and that is the center and the oncology people that are treating me, I took care of many, many of their patients.
Right.
Now here you turn around, now you're a patient.
Yeah. It's such a strange juxtaposition. You're used to walking in, everybody's like, oh, the doctor's here, thank God. What can you tell us, doctor? I mean, that's what it's like when you're in the hospital yourself or you're with the patient. And now here you are prone in the hospital bed. It's such a 180 degree difference, right?
Oh, absolutely. And, being certified in patient safety, you see all kinds of things, errors like, wait a minute, this, that, and you can see why healthcare really needs change and seeing it from this side of the street, but, knowing things makes a difference. And I think to myself, what if I didn't have that knowledge? Just a regular family member, you have no clue. People
Yeah.
are telling you this and that or whatever, at least this way, I have some idea of what's going on and can challenge and question and come up with plans. So yes, it's a totally different perspective for being where I was to where I am now. The idea with the book, interestingly enough, Logan, was initially I thought I was going to write a book. The first book, What My Hands, was about what it took to be a heart surgeon. Then I thought to myself, you know what? Now let's go for it. Let's talk about my life. This is
Yeah.
about growing up. Let's talk about people telling you you can't do it. You can't do it. You can't do it. You're not smart enough. And then you meet a person who changes your whole menu in your brain and says, yeah, you can. And the rest is history.
Yeah.
Having that kind of a change has been
Yeah.
remarkable.
Are you still practicing as a doctor?
Well, I'm an emeritus professor, so I'm still teaching. I run a surgery department of medical education. I have a research lab, and I'm in charge of the students for the surgery clerkship when they're on their third year. But I had to shut down the clinical practice because of the back and all the
Yeah.
therapies, all those things, which is unfortunate.
but you're still active in healthcare, which is great, giving your knowledge, your expertise, and your experience to new generations of heart surgeons and so forth who are coming
Uh,
up.
Absolutely. Teaching students, residents, and everybody, you're giving you part of that back is just so rewarding,
Hmm.
being able to do that. And, I've had a couple of my residents, one's a trauma surgeon, and he called me late at night and said, "Hey, I just got to let you know this. I know it's late, but you taught me something to do, a technique, and I saved the guy's life."
Right.
That was phenomenal.
Exactly,
Yeah.
exactly. And the role of a heart surgeon mentoring another surgeon is enormous because generally that's all of the training a heart surgeon will get working with a doctor like you. So if you're teaching them a technique that's saving time, eliminating bleeding, that kind of thing,
Right.
it's a game changer, right?
Absolutely.
Yeah.
Yeah. And like I said, sometimes, just seeing, the students, I've had a couple, my res they were one was my student, took my honors class. She became an intern, a resident, a trauma surgeon, and now she's a very active trauma surgeon in Plano, Texas. It's
Yeah.
unbelievable, to see that.
That's wonderful.
Yeah.
Yeah, it's very rewarding when you see the next generation getting ahead. Let's talk about the title of your book,
Sure.
This
Yeah.
to Me. What do you mean by that?
Okay. Well, there's two books. The first one was Wet My Hands, and the
Mhm.
second was This to Me. So, Wet My Hands was about tying knots. Our big chief would have the tech squirt water on your fingers to help the knots slide down and get tighter. So
Mm,
that was the idea of the first book. The second one, This to Me, is he'd put his hand out and say, "This to me," which meant that everybody agrees that this is the surgery we're going to do. This is the correct side. Everything's correct before he would be handed the scalpel.
mm.
And there's an early patient safety thing. So I thought these would be two great titles,
Yeah,
for my book.
absolutely. Absolutely. Tell us a little bit about your first challenge that you dealt with. You're a successful surgeon, very, very busy. Is your first challenge dealing with your wife's illness, or did your own
Yeah.
illness found? Your wife's
No,
illness was
yeah,
first,
the
right?
first was her diagnosis of this very rare form of bladder cancer called urachal adenocarcinoma,
Hmm.
1 in 5 million.
Wow.
Yeah, MD Anderson had like 30 patients only, and the survivability is very low. And she's now 8 years out. She had a robotic partial resection of her bladder, and that kind of changed things. She
Mhm.
retired, and we thought, okay, we got through that hurdle. Wow. And then the stroke.
Yeah. And what age did these illnesses strike her?
She was in her late 60s.
Yeah.
Yeah,
Yeah.
yeah, yeah. The,
Yeah.
the stroke was devastating, and we had just gotten back from the vacation, and I would get her up really early, like 3 in the morning, to work out before my surgeries would start.
Yeah.
And she was totally, like a rag doll, and I knew exactly what was going on. Um, so we rushed her down to our hospital, to the interventional suite, and I could hear the excitement when they extracted the clot out of her brain because she had no blood flow to the whole half of her brain. And
God.
if I didn't have the knowledge, I wouldn't have known what was going on. She wouldn't
Yeah.
be. So
Yeah. If
she,
it happened to a lay person, your wife would have died. But you just
yeah,
because you knew immediately that it was a stroke, you
right,
knew exactly how to get her care.
yeah,
You
yeah,
saved her life. So
yeah.
that obviously has probably an ongoing challenge, right? Your wife's still with you? Yeah.
Yes, yeah.
Yeah.
The problem is the speech, and now what happens then with many times with bigger strokes, you get more of dementia, and that's
Yeah.
starting to picture, which has been very, very frustrating trying to be patient and working through that. You
Yeah.
know, and of course, probably a lot of my illness probably hasn't helped things, adding some added stressors. But
Right.
August 1st, 2000, 24 will be our 50th anniversary.
Wonderful. Wonderful. Well, happy anniversary in
Yeah,
advance. I don't think there's any greater way to show your love for someone than to take care of her like you have.
yeah.
So
Thank you.
that's where the devotion comes in, and obviously for sickness and in health for sure. When it comes to sickness, multiple myeloma is an illness you are facing, and still facing apparently, right? There's no cure for
Yeah,
multiple
there's no
myeloma.
real cure. It's a cancer in the bone marrow,
Hmm.
and basically all you can do is basically keep it under control,
Yeah.
and by looking at different blood markers, but it's always present, you
Yeah.
know. In the 80s or so forth, the survivability wasn't very good. The newer therapies with monoclonal antibodies and
Mhm.
understanding better how to treat cancers have really helped the survivability rate.
Yeah. So basically, you tried to keep it in remission
Right,
or
right.
with using chemotherapy or radiation?
Chemo,
Chemo.
yeah, yeah,
Yeah.
chemotherapy based on a different kind of modality than the old time chemotherapy, more of
Right.
a therapy to attack it. The problem with multiple myeloma because it's in the bone, and so I've had multiple back surgeries to reconstruct and replace that
Right.
vertebra. It was gone. It was
Yeah.
just totally destroyed. Yeah,
Awful.
I
Awful.
thought I had a disc.
Yeah.
Who would have
Yeah.
thought?
I know. And by any other twist of fate, that would have been it, and
Exactly.
end of
Yeah.
story, you get the disc fixed, you live with it, whatever it might be. Um, your narrative is filled with humor as well, despite the trials you faced. How important is it, do you think, to have laughter and humor in coping with life's toughest challenges?
Oh, that's so important. We've talked about that. My wife and I have always felt we've had to have some humor in our marriage.
Yeah.
And when I wrote the book, I put in some stories in there that get a lot of laughter out of people of things that have
Yeah.
happened and so forth.
Mm.
Because I think that's important to have that full range of emotion. When you face things like your own disease, non-curable, your wife with the thing, you've got to have some other outlet in order to
Yeah.
keep you, kind of going. Um,
And you got to
and
be who you were. You're a humorous guy at times and you want to
yeah,
be funny, laugh. I mean, despite the circumstances. I mean, I guess it's why people laugh at funerals and wakes and that kind of thing because they're remembering the good parts of the people.
I mean, just that good feeling, I think then releases a lot of chemicals that we have in us that kind of help our mood elevators and make
Exactly.
you feel better.
Exactly.
Um,
Exactly.
yeah, I always try and
Well,
add a lot of humor. I add a lot of humor when I teach my students, hopefully that, then different things will stick to them.
yeah, absolutely. When infrequently I've been in the hospital, but when I am in the hospital, I'll totally pretend like I'm completely out of it when a guest walks in, when a visitor walks in. They're like, "Are you okay?" I'm like, "Yeah, I'm fine," that kind of thing.
Yeah,
So yeah, humor is the best medicine, as Reader's Digest used to say. You've
absolutely.
seen a lot of advancements over the years in your own career. They've impacted your journey as well. Tell us a little bit as you look back at how the medical establishment is, thriving right now with robotic care, with gene splicing, with the targeted, RNA vaccines. We're living in a very exciting time when it comes to medicine, right?
Yeah, it's a great time. However, I'm very concerned, and I'm concerned that we're losing some of that touch with the patient and relying more on diagnostics, X-rays, different techniques instead of
Mm.
let's get connected to the patient.
Yeah,
I think that's so important, and I see a lack of that in healthcare, and that bothers me. And we're trying to make sure that our students understand the importance of that one-on-one between you as a physician and the patient and the family. And
yeah,
all the other technology and everything is great to help cure or diagnose, but you're the one with that interaction that really we need to really be sure we continue. Um, and I'm passionate about that.
yeah. Well, unfortunately, the whole medical industry has changed. It's hard to find a physician. Generally, you're pawned off to a physician's assistant
Gender.
or a nurse practitioner.
Right.
If you get actually to see a doctor, it's a miracle. If you get to see the same doctor for every appointment, it's truly a miracle. So, there are a few dedicated healthcare providers out there. One of my buddies is a doctor, hates that term. He says, I'm a doctor, I'm not a healthcare provider.
Right. 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 Right.
Um, so, we with something gained, there is something lost.
Yeah.
So, there are these great diagnostic tools, there are all these great technologies at the ready, but the importance of having a great rapport with your doctor. I'm blessed to have the greatest cardiologist in the world. He gives me his cell phone number, his email, he takes my calls, and he's like a Columbia Presbyterian, but it's
Yeah.
like he's my own personal doctor. And
Yeah.
it's wonderful. Everybody should be blessed to have a physician like that, right?
Yeah. I'm very lucky because, being on this side of the street, if I tell the funny story, and that is my dean is my primary care doctor, and he's 2 doors down from me. So I go down
Yeah.
there with my lab or whatever, and say, "Hey, Frank, take a look at this, take a look at that," or I can speed dial. I'm going to tell you a
Exactly.
story. I woke up about 3 years ago, and I clotted off my arm from one of the chemotherapy drugs.
Wow.
So I called one of my partners, get me down. We interventional lab and so forth. They couldn't get the clot out, so they called one of the surgeons who I operated in room 2. He would operate in room 1. And he said, "Okay, I'll take care of you in the morning." About 10
Mm.
o'clock at night, my hand was white and cold. I called
Right.
the OR crew, anesthesia, set up the room, and called them and said, "Get out of bed. You're coming to surgery now."
Right.
No one else
Right.
can do that unless,
Exactly.
you know,
Exactly.
but
Thank
certainly,
goodness for some connections, you know?
yeah.
Yeah,
Unfortunately,
exactly.
like I said, it's very important, I think, to have that connection. You're very fortunate to be able to have that, to be able to call your doctor, feel assured. And you're right. Unfortunately, it's very hard to hear people say, "Yeah, I can't see that doctor for 3 months." It's
Right.
like, what? 3 months?
Oh, yeah. Oh,
You know,
3 months is pretty good. I mean, if you're a new patient to a doctor, it can take 3, 6, 9 months to
I,
nearly a year to get
and
in.
I always told my staff, I said, "I don't care if I'm overbooked, figure out a way, work them in, get these people in because
Yeah.
this is important, because I did a lot of lung cancer surgery as well. You don't
Right.
want to sit around for weeks waiting. You want to
Right.
get it taken care of. The
Exactly.
faster you do that, they go to surgery. I've resected out the tumor, find out now they've got a surgical quote unquote cure. What a difference than waiting weeks and weeks and weeks.
Yeah, exactly.
So,
Exactly.
in the book talks about all the things and about that can occur, and hopefully people kind of get an idea. In the second book, this to me, I talk about some of my most interesting cases, right? To think out of the box, of how to take care of this patient, things that you got to use some intuition. A guy
Hmm.
aspirated a big nail in his lung they couldn't get out. I've never seen that before, but I've heard a way
Right.
to get it out and different. It's like sometimes you have to just be innovative and make that connection. And so book 2 has some of those stories in there.
Well, that is fascinating. It's fascinating stuff. I actually had one of my buddies is a anesthesiologist, and he had a talk with me about cardiologists, uh, specifically cardiac surgeons. And he said, they really are cowboys. They really are gunslingers. They kind of really do their own thing. Generally, they don't like to have the doctor they're training do anything other than sew up for them when they're done. He said you wouldn't believe how little experience some cardiac surgeon residents have. And
Yeah.
it's all dependent on the relationship they have with the attending that is training them. And nothing really is routine when it comes to the heart
Yeah.
and the lungs, and I guess
No,
the human body in general. So you really are called to improvise, right?
I was very fortunate. I trained in New Jersey at the DeBoer Heart and Lung Center,
Sure.
and it was a 3-year program. Most programs are 2. Mine was 3. I did 1,500 open hearts.
Amazing.
Phenomenal. And I
Yeah.
had a very tough trainer, but in the end now, I see what he taught me, what he gave me. He's very, pleased about the book and the book titles because those are the terms he used. But you know, he really it's tough training.
Yeah.
But in the end, you're in a very precarious situation as a heart surgeon.
Yeah.
As we say in an octogenarian, someone over 80, you get one chance
Right.
you know, and if things don't go well, they're not going to go well. But the other
Right.
thing I always told my students, we won't leave the operating room until we're sure we've done everything we can.
Yeah.
You know, we'll see what happens and come back. You just can't do that. But,
Yeah.
you know,
Yeah, it's amazing. And I've actually said to some, I've had cardiac ablation done for atrial fibrillation.
welcome to the club. Me too.
Uh, Not a fun procedure.
Well,
Knocked me out for a long time. But I said to my doctor, I said, do me a favor, I want you to do it. I don't want your team to do it.
right.
And he said, there's too much equipment for me to operate on my own.
Yeah.
He
Yeah.
said, we need about 12 people in there. He said, I'll do everything I can possibly do myself, I will. And
Yeah.
so,
Yeah. We did mine. We did mine on a holiday, Memorial Day, and it was by the program director for electrophysiology cardiac program. You know, he
Mhm.
had his fellows there, but he did it and very complicated ablation, but he did it on a, you know, where he could take his time. He didn't have another case and got and I've been great for now a couple of years. I hope you are too.
Yeah, 4 years and in sinus the entire time. So thank goodness.
I hate being cardioverted. Had
Oh,
electric shock.
exactly. And for the folks at home who are watching, cardioversion is like almost like when they're putting the paddles on
Right.
you to restart your heart. They're restarting you to a rhythm,
Right.
and it's awful. And I didn't
Right.
like being an AFib. Some people are an AFib and don't mind it, don't
Oh,
realize it. For me, I was like I couldn't walk.
yeah, it's a bad feeling.
Yeah, it is a bad
Plus
feeling.
a stroke risk.
Exactly, exactly. So, knock wood, 4 years and going, and you're a few years and going as well. Which brings me to another part of your book is
Yeah.
fate. It
Yes.
has a real part in our life's journey.
Yeah.
Tell us about your feelings about fate.
Yeah. What it's interesting. Back in college, I took a course on Greek and Roman mythology, and in it they talk about the three fates and how they weave and cut and tie, and you know how your life is woven, and how even the big god Zeus was afraid of the fates. You know, and so I kind of wove that into the book about all the little things that happen in life. You know, the golden threads of meeting my wife. You know, cutting the thread of her stroke, cutting the thread of my cancer, reweaving that in the next phase. I just thought it was kind of a different way to look at it. You know, look at how
Yeah,
things occur in life. You know,
yeah,
sometimes you never can plan. You know, and sometimes you're surprised. And again, you said something about resiliency. You know, or you reconnect those threads and then have to have the resiliency to move on.
yeah.
You know,
Absolutely. And it's funny, my two best friends are doctors. One's an anesthesiologist and one's a critical care specialist. And the critical care specialist always says life can turn on a dime. A-
absolutely.
And that's what you learn as a doctor. And that's what you learn, unfortunately, as you get older. You see people who are look great, no problem, and boom. So we do what the best we can to be healthy and to live a long, healthy life. But
Yeah.
fate plays a role in that, where
Yeah. I
our
mean,
genes were destined by a little bit and that kind
yeah.
of thing.
I mean, I was great. I was very, my wife was a dietitian, so of course we ate healthy. You know, I was on like no medications. You know, I was doing half marathons, working out, all this kind of stuff. And
Right.
I'm not gonna tell you what I got on the cabinet now as far as pharmacy. I told the pharmacist, "Do you have a job opening for me? I come here so much for pharmacy." You know, uh,
Exactly.
it totally changes the picture of where you are, uh, you know, on that, and then you have to kind of modify your life a bit, and
Yeah,
so. But you know,
I
the other
know.
thing is, Logan, what I want to be sure is that when I did this, very strong about student scholarships and about the royalties and so forth, going back to two funds. One is the General University of North Texas Health Science Center at the College of Osteopathic Medicine, and the other one is at the University of Strathclyde in Glasgow, Scotland, where I'm a visiting professor in biomedical engineering. And I
Gotcha.
always feel that to help the students, you know, but I can build this, you know, scholarship things. So some students who maybe kind of like me didn't have the resources from family, but have an avenue to help them be successful. And you know what? They may come up with the next cure, or they may come up with such and such, or you know what? Save a patient.
Yeah,
I mean,
exactly.
that's great.
Exactly, exactly. Recently, I forget which billionaire it was, but he gave $1 billion to Mount Sinai Medical College. So tuition going forward, including the students who are there now, is free.
Yeah.
So it sounds like that's all it takes. I mean, $1 billion
Yes.
is a lot
Yeah.
of money, but that is all it takes is a few of the billionaires in this country to endow each
Yeah.
medical school with $1 billion that'll be a tuition fund. And, you know, then it won't matter what your economic situation is.
Right.
It won't be determining whether or not you're a doctor.
Yeah. There's been quotes about medical student debt being $400,000.
That's crazy. That's
Yeah.
crazy. Yeah. Yeah.
Yeah.
And no
Unbelievable.
matter what, and then also that plays into the decision as to what specialty you're going to
Yes.
partake in. You're less
Right.
likely to become a pediatrician or a
Right.
family doctor, the lower priced specialties,
Right.
right? Yeah.
No, that is true.
Yeah.
That's true.
You mentioned Scotland before, so I have to ask you about your Scottish fold kittens that are a
Ah,
part of your
yeah.
life. Tell us about those, and I'm sure they're a great They boost your spirits when
They
things.
do. We started out with the first one when I was a medical student, and her name was Sisterly. I hate your Sisterly. She was our first Scottish fold, and we've had them since. They're unbelievable. They've got rounded heads, folded ears, interesting personalities, very lovable, want to be near you, but they're very lazy,
Yeah.
you know. But they're very friendly, and that's what. Yeah, that's kind of fun. As a matter of fact, a friend of mine was visiting here. Professor Gurley, and he's Scottish. So he starts talking Gaelic to one of the cats. They're like listening to them, and I was kind of kidding around with him.
That's
But
funny.
and the University of Strathclyde thing was great. It was a biomedical thing where we have a transition between our university and them as far as research and with my colleague, and I really like that aspect and seeing what their students are doing compared to our students and getting the both students together is a lot of fun.
Absolutely. What do you hope readers take away from your book?
Yeah. What I hope they take away is that, people tell you can't do this, you can't do this, all that negativity, and then finally show that you can. And suddenly now you're like, okay, I'm doing it. I'm, head of this organization, head of the board of surgery, all these things.
Mhm.
And then suddenly your life, a devastating thing happens in your life. Now you've got to reprogram, rethink all this and think about the loved one that helped you get there, and all that in yourself, and then kind of read it. And I want them to see that life transitions, that it
Yeah.
can go from this to the high to the low, and being able to navigate through that. So I wanted a lot of that emotion in there that people get a feel for that.
Yeah. Yeah. It's very, very true. Like we said, life does turn on a dime. Unfortunately, we'll all be in that backless gown at one point during our lives, and it ain't
Yeah,
fun.
it is.
And perhaps the most comforting sound in the world for me is when I hear my wife's heels clicking down the hallway coming to see me. It's just like,
Yeah,
oh my God, I'll get to feel like a human being again just to see her. So
yeah.
it's so important, the relation. And you stress that in the book with your wife, Sharon. I mean, I think probably her illness has made you guys even closer and even stronger, right?
Absolutely. Yeah. It's been very, kind of a stressful thing because of, each one. But yeah, it kind of shows you that, wow, how important this person has been in your life, continues to be in your life, and both of us supporting each other and the care that you give. Yeah, it's so important. There's a lot of heart surgeons that never, keep that first wife. They're on their second or third, you
Yeah.
know, been very fortunate to have someone who believed in me, so forth, supportive myself with her, and the both of us. And, it's like a team,
Yeah.
it's a team.
Yeah, it is a team. Yeah, and it's funny. We were talking about your patients were blessed to have you as a doctor, no doubt, because you're a humble, kind person. And now I remember what triggered my conversation with my anesthesiology doctor friend is that he used to do anesthesiology for cardiac surgeons until he said I couldn't stand working with them anymore. He said he
Yeah.
had such big egos that he couldn't fit in the room anymore.
I was always told I was a different kind of a heart surgeon because I was actually friendly. I actually respected my staff, and my staff in the OR loved working with me. They knew
Right.
what I wanted, they knew what I expected. I rewarded them, I thanked them.
Yeah.
If
Yeah.
something went wrong, I didn't blame them.
Right.
My responsibility. I
Exactly.
didn't blame anesthesia. I
Yeah.
took care of it. And I think they respected that, and they all loved working with me. Some of the other heart surgeons, they didn't like coming to work. I mean, they would come and start cases early and so forth, and you know, so and the percolated to the recovery, the ICU, the whole thing down the line on the nursing staff and so
Yeah.
forth, and now
I
I'm glad
think
I treated them well because some of them are taking care of me now as a patient.
exactly, exactly. It came full circle. So that's important too. But I also think you're going to get better outcomes because your team is more
That's good.
inspired, more comfortable, more
Yes.
relaxed, and up to do their best work. This book is amazing. It is called This to Me. It is written by Dr. Albert Uvardi. He shares his profound journey from a national and international medical expert to a devoted caregiver for his soulmate, Sharon, to his personal battles with health issues. It's an important book. It's more than just a memoir. It's a testament to the human spirit, and it is highly recommended. Doctor, thanks so much for spending some time with us here today on Spotlight.
Well, thank you very much, and I appreciate it, Logan.
I enjoyed our talk very much. To the
Okay.
folks at home, I'm Logan Crawford, thanking you for your time this time. Until next time on Spotlight.